Hello friends, myself Dr. Samrat Jankar, and today I am here to review one of the course. On 12th October 2022, I have attended AWR cadaver course in KEM hospital. I thought the course content and the course what had been conducted by Dr. Jignesh sir and team was fabulous. I thought this effort should get appreciated. At the same time, he has done so much of good work and his team is trying to deliver so much of good content. It should reach more number of surgeons so that more number of beneficiaries will be there, like me, one of them. Friends, on 12th October, I attended this course. Before joining this course, I tried 3 times a message and connected with Dr. Jignesh sir to include me as one of the participant. Because of might be logistic and there is waiting number of people, waiting surgeon number is long. Because of that, he couldn't accommodate in 2 courses, and 3rd course I got opportunity to enroll for this course. My intention was going to see what's happening, learn from the masters. I believe in that earning will increase only we increase our learning. So that was an opportunity, and for that reason I went to learn from these masters, Dr. Rahul Madar and Dr. Jignesh Gandhi, from cadaveric hands-on workshop. This is the workshop cadaveric. Prior I have attended many places. Cadaveric workshops I have seen, colorectal and hernia workshop, but the preservation technique might be something issue, or the cadaver storage technique may be some problem. But the way the Roto-Soto department headed by Dr. Sujata Patwardhan in KEM hospital, the way they preserve cadaver is superb. They keep the cadaver in deep freezer at -20 degrees Celsius, and when any course has been planned, 3-4 courses regarding different speciality, they club together, and 3 days prior they start taking the cadaver -20 to -5, and on the day of course it will be as good as at the normal temperature and having the texture very nice, simulating to a normal live patient which is lying on the bed and having anesthetized. The cadaver quality is superb. There is no smell, there is no formalin, and texture of the cadaver is fantastic. And one thing I can tell is these cadaver are even better than learning on the live human in OR theater. There is 2 reasons I can tell this. One is the live surgery, when we want to learn from the master that time, or we want to attempt under guidance of master that time, main problem will come from blood which spoils the space. In fact, in AWR cases, when we want to do TAR procedure, laparoscopic ETEP-RS procedure, laparoscopic inguinal hernia procedure, there is few of the blood vessel which are coming, which spoils our field, and lot of time we will not appreciate even in live operative workshops also. That is absolutely not there. These are the live patient without having the blood trouble. And also, even we are learning from the best of the best people in the live operative workshop, then trouble is the operating surgeon cannot completely hand over the subject to a trainee, because the skill level are needed, and if something goes wrong, it's true that will make lot of trouble to the patient in post-op. So in these cases we will get actually hands-on, the port placement and use of instrument, suturing and doing TAR procedure, anterior component procedure, we can actually do under guidance of these masters. Coming to the faculty, we all know these Dr. Jignesh sir and Dr. Rahul Madar. These are the star faculty who teaches across the globe, and these people are conducting these courses, means we will get the best of the best content. Along with these 2 star faculty, Dr. Sadashiv, Dr. Praveen, Dr. Yogesh, Dr. Prajapati, these all people are contributing for the best of the best content which can be delivered to us within short period of 8 to 10 hours of a 1-day workshop. Coming to the flow of the workshop, any workshop, maintaining the participant in actively learning phase is most important. They have devised this course in such a way that there will be a two-part. Once we go there at 8:30, there will be a meet and greet, and then they will hand over you a kit for going for the workshop. The kit content of 2 scrubs, 2 gowns and gloves, caps, everything which is needed. We need to go in our own scrub. Rest of the thing they will give in a 2 pair. So in morning session what they will make is, first is laparoscopic, because once we do open we cannot do laparoscopy. First we learn the laparoscopy. In that we need to have 2 lecture on ETEP-RS and ETEP-inguinal by the faculty. Followed by, these lectures are also so much precisely they have made, where we will not go anything in theoretical, it will be purely practical tips training. Followed by, they will take us to cadaveric lab, that will be a 1 floor above. The labs has been such a well they have made, it's kind of OR theatre, operating theatre, where 2 table has been placed with all laparoscopic instrument, all camera devices, energy devices, and also ports. CO2 insufflator, means as good as your OR theatre set for the any laparoscopic surgery, including what needed is best of the best. Open instruments also available in 2 set in the theatre. Once we start the procedure, morning procedure, we will start from ETEP-RS. The faculty will demonstrate where to put the ports, how to place the ports, how to start the surgery, and even we can get how to go in. All technique tips and tips the faculty will train us. Once we start the procedure, they will do one side ETEP-RS, crossover, and other side ETEP-RS will be done by the participant. Followed by inguinal, ETEP-inguinal, all things, a triangle of doom, space of Bogro, space of Ridges, everything they will demonstrate and make sure that we will also do those procedure. In fact, these cadavers are so well maintained, every space is able to achieve, and in those days when I attended both cadaver, we were able to do all kind of endoscopic procedure. Once morning till 1 o'clock endoscopic procedure finishes, half hour there will be a lunch break, followed by again anterior component and ETEP-RS TAR procedure. They will give the teaching, and followed by again we will have a last session of having hands-on on cadaver open procedure. In the open procedure, they will start doing one side anterior component separation. They will demonstrate where to start, how to start, and including what are the plus, minus, where to do and how not to do, everything they will teach. And other side, they expect that participants, someone of us will do it, and they will stand with us and make sure that the surgeon, participating surgeon, will do actual hands-on anterior component. Followed by the posterior component will be done, the posterior component separation TAR procedure will be done by the faculty. In fact, they will demonstrate each and every aspect of posterior component, top up approach, top down approach, and step up, step down, everything they will demonstrate. And here end of the day will be, we will learn all thing about laparoscopy and open abdominal wall reconstruction, along with technical tips about the procedures will be learned. We will gain everything. Talking about the fee, I personally feel we as a surgeon, every field does that, they invest to increase their earning. So if we are earning, we should invest for our learning also. If I can tell the fee that it is an average or good surgeon what he earns every month, it is not 10% of his earning. So we should not think about that, we should go and learn the best of the best thing from this faculty. And who can do this procedure, who can attend this cadaveric workshop? I personally feel the content, the faculty and cadaver whom we are seeing everything in that scenario, the basic surgery doing resident till the star faculty who is doing routinely ETEPs and even having some struggle doing few of the procedures, how to go for the subcostal approaches, how to go for the upper abdominal tar, upper abdominal part tar, in those all things are there, somewhere we will fumble. Everyone can attend this course, everyone will gain good from these people. I personally feel these people are the Dr. Jidnesh sir and their team, they are putting lot of effort to give best of the best on the cadaver to all the surgeons. We all surgeons should involve and gain more and more from them and do our practices with good learning. Thank you.